Hello everyone, welcome to Pharma Podcast. Today I will be talking on quality management system. Before going into details of quality management system, I would like to discuss something on this sentence, that is, quality should be built into the product and testing alone cannot be relied on to ensure product quality. That means each and every stage of manufacturing should be done in a controlled way so that quality is built into the product, and you cannot just rely on testing part. So each and every stage of manufacturing should take care of quality. So these are the basic key elements of quality management system, and I will divide my videos on these topics, and I will be covering each topics in different videos. So today I will start with deviation management. So what is deviation? Any departure from an approved instruction or any established standard or parameter or any incident that could affect product quality or the reliability of record. So failure to follow written instructions, protocols, procedures is called deviation. So let us understand with example what is deviation. So previous product container was found in the area during line clearance. So what is standard operating procedure says? As per standard operating procedure during line clearance of the area, no any traces of previous product should be present in the area. So in this case what has happened? The previous product was identified during line clearance, so a standard operating procedure was not followed. So this is an example of deviation. So there can be n number of scenarios where standard operating procedure or protocol might have not been followed, and this can result in a deviation. Now we should understand the different types of deviations. So types of deviation, there are basically three categories: critical, major and minor. What is critical deviation? So any deviation from standard operating procedure, your protocols, any incident which has high probability to have impact on patient health, like if it affects critical quality attribute of the product. Suppose in case of sterile manufacturing, sterile products, sterility is a key quality attribute, and if failure in any deviation which has impact on sterility is critical. Second is major. When the deviation affects a quality attribute, a critical process parameter, an equipment or instrument critical for process or control of which the impact to patient is unlikely or that might adversely affect the SISPQ, that is safety, identity, strength, purity and quality of the product or integrity of the data. So probability is less, then it's a major. Now minor. When the deviation does not affect any quality attribute, a critical process parameter or any impact on instrument. Generally if any recording error during manufacturing process, person is skipping the process writing during batch manufacturing, any recording error, any such examples are example of minor deviation. Now it is important to understand what is the next step. After the categorization of deviation, it's important to handle these deviations, and handling of deviation means investigating these scenarios. So in next video I will be talking about the investigations, different tools and how to identify the root causes and kappa. Thanks for watching. Please subscribe and do like the channel too.